One of the most common infectious diseases worldwide, hepatitis C, affects 170 million people, with over 3 to 4 million new cases every year. Due to the lack of specific symptoms, 80% of hepatitis C patients are unaware that they are infected. By the time they consult a physician, liver disease is often advanced. More than 350,000 people are estimated to die from hepatitis C-related liver diseases every year. Whilst there is no vaccine, the good news is that with current treatments, hepatitis C is curable in many patients. The way hepatitis C is managed should depend on the individual needs of the patient and will vary dependent on the stage of disease, viral genotype, the patient's own genetics and comorbidities, among other factors.
At least 20% of patients develop significant liver problems. So of patients infected and exposed to hepatitis C, we would expect 4 out of every 5 to go on to develop the chronic infection. Of those patients with chronic hepatitis C, we would expect somewhere around 20 to 30% to develop cirrhosis, and many of those tragically will go on to develop liver cancer. Very often patients complain of tiredness and rather non-specific complaints, but they don't realize they've been infected with hepatitis C, and sitting in their liver is this time bomb waiting to go off and destroy their lives as they develop cirrhosis and liver cancer.
Patients with more advanced stages of liver disease are less likely to respond to treatment and are more difficult to cure. The hepatitis C virus has different types known as genotypes. There are 6 main genotypes and more than 50 subtypes. The prevalence of each genotype varies across the world. Treatment success is largely determined by the genotype of the virus, with genotype 1 being the most common and its subtype 1A the most difficult to cure. The 2 genotype 1 subtypes are vastly different and require a tailored treatment approach.
Some of these subtypes share only 70% homology, whereas you and I are 97% related to the chimpanzees. So these viruses are more distant than some of our genetic relatedness to other animals.
Genetic factors also have an influence. For example, changes in the genetic code of the IL-28B gene have been found to affect the likelihood of hepatitis C treatment success, with viral cure more likely in people with the CC genotype. Other patient factors that affect treatment response include age, gender, ethnicity, and the presence of other conditions or comorbidities. As both hepatitis C and HIV share similar modes of transmission, many individuals with HIV also have hepatitis C infection. In these patients, the hepatitis C viral load is higher and they can be more difficult to cure. These patients often require additional medication to treat comorbidities, and this can result in drug-drug interactions. An assessment of the medications being taken is a vital step before selecting an appropriate hepatitis C treatment.
It will be not that easy. There will not be one size fits all for every patient. We have to consider the patient first. We have to look what characteristics does this respective patient has, and then based on these characteristics, treatment decisions.
In the future, doctors will have an armory of treatments to choose from, offering patients an increased likelihood of achieving cure. However, no 2 patients are the same, and a personalised, patient-centric approach will be important to ensure each patient receives the best treatment for them.